Hi guys, good afternoon. Welcome to a chat about ADHD in women and girls. I'm just sort of stumbling upon this subject as I kind of naively just thought it was a boys thing, and kids grew out of it. And to be honest, it's only just come on my radar over the past few years about adults having ADHD and particularly women having slightly different symptoms. So I'm going to be joined by Dr Rachel Gow, who's got a fantastic practice called Nutritious Minds. She's also got a book coming out. I don't think it's out yet, but I'll ask her. And yeah, let's dive straight in. I've got about 45 minutes because, of course, online learning downstairs. No one's learning a thing. Actually, I am. I've remembered how to do a long division, would you believe? So hang on, where is she? Nutritious Minds, where is she? There she go. I'm going to send you an invitation. Let's see if she can join me. Sometimes I get trouble with this. But hey! Perfect.
Hi! How are you?
I'm fine, thank you. Really good. Well, no,
Good.
Not good at all. I feel like I'm spinning a million plates, you know.
I've got my headphones on today because I know last time we had a bit of an issue. So can you hear me okay? Yeah,
absolutely
wonderful.
Perfect. Okay,
yeah.
Rachel, for those of my followers who've never met you before, even though you've been on a few times, would you introduce yourself and also let them know immediately where they can get in touch with you after this?
Yeah, absolutely. So in terms of my research and training, I'm a child neuropsychologist. Specializing in neurodevelopmental conditions such as ADHD and autism. And I'm also a registered nutritionist under the category of science. And you can find me by following nutritious_minds, and also I have various websites as well that I'm sure you can post links to later on.
Yeah, I've got my notebook.
Brilliant. Yeah, I've got some notes today too.
As best as I can. But if I put anything wrong, please just feel free to come in and edit.
Okay, yeah.
So I wanted to dive straight in.
Sure.
Why is it only now sort of like awareness about women with ADHD, not just girls, because I want to come on to diagnosing girls a little bit later. But why has it never been in the general domain that women actually have ADHD? And the fact that I often find I can't multitask is a bit of a cardinal sin, because that's what women are meant to be able to do superior to men.
Yeah, absolutely. So let's look a little, let's turn to the statistics firstly. So around 5 million women in America are diagnosed with attention deficit disorder, also known as ADD. And in the UK, it's estimated that between 3 and 5% of school children and around 2% of adults are also diagnosed with ADHD. So in a translational sense, this equates to approximately 12.9% of boys compared to just 5.6% of females.
So is that because they've been diagnosed? So there might be people who are suffering out there, but we've not diagnosed them yet. They don't know they've got it. Right.
Exactly.
Okay. So it could be a huge under.
Absolutely. Yeah. So we know that the Centre for the Prevention and Control of Diseases have said it's not because girls don't suffer with this condition. It's rather more a case, as you said, of under-identifying and misdiagnosing, which I'm sure we'll come to. We'll talk about how the symptoms present differently in girls and then in females. But I think this is important to note that it's not just in a clinical setting, but it's also happening in a research setting. So as you know, Davinia, much of my research is in neuroimaging. And in a neuroimaging setting, the majority of the data collected is also in boys, and males. And not just boys, but also right-handed boys. So basically, this raises
so it's not a real fair cohort of the population at all. Once again, it's one-sided on male.
Absolutely, because of course, this raises kind of ethical considerations regarding the inclusion of participants in clinical trials, because essentially that data, filters out into the public domain and is predominantly focused on right-handed boys and adult males. So yeah, this is another consideration, given now the risks, the increasing risks that we know about in, you know, teenagers and women with undiagnosed ADHD.
Fabulous. Could you please explain what you might want to look out for in females?
Yeah, of course.
I mean, it's not just ADHD, it's just neurodiversity, isn't it? Because it's such, can you just explain that umbrella and why we can't really pigeonhole it?
Absolutely. So basically, neurodevelopmental conditions exist on a spectrum, which is wide ranging. I mean, most of us will experience kind of mild symptoms of ADD or ADHD in our lifetime. You know, many of us will struggle with concentration or, you know, be inattentive or perhaps be a little impulsive. That's not to say that you would meet diagnostic criteria at all. And oftentimes it's not until you know, females or mothers have their own children assessed, you know, seek out diagnostic assessments, that they recognize the patterns and symptoms in themselves. And that leads them to investigating whether or not potentially they may have ADD or ADHD, because as we know, there is a large genetic component to the condition. It is hereditary. In other words, it runs in families. So I think that's really important to point out as well. And certainly we can explain the differences in terms of, you know, males being diagnosed more than females. There's a 4-to-1 ratio, by the way, so it's pretty high. And this is because boys present with what's called more overt features or symptoms. So boys tend to be more boisterous. They are more likely to be disruptive, certainly due to sort of higher levels of impulsivity and hyperactivity. So they're more likely in the classroom setting, you know, to get up out of their seat or to blurt out answers. Whereas with girls, the behavior is less obvious. So they display what's called more covert features. So covert just meaning concealed. So they may be, you know, quietly daydreaming during class and, you know, frequently zone in and out, but they're not being
like
disruptive.
That, I used to get called Dolly Daydream.
Yeah, that's right. Often
who is this Dolly?
I don't know. I have no idea. But yeah, girls are often called ditzy or scatty or disorganized.
Oh my God, it's like anti-woke brigade.
I know.
Say that.
I know. It's terrible, really. But
as
as like
50s, isn't it?
Yeah, it really is. And I think girls present with, you know, symptoms at very different levels. For example, they may struggle with their peer relationships or with their friendships. They may have what's called, and certainly females of ADHD have this, called the imposter syndrome. So they feel like something's not quite right, that they don't quite fit in, that there's something different about them. You know, they may frequently interrupt during, you know, conversations or just be annoying to their peers, which can cause, you know, conflict. Also at home, in family relationships, they may be overly emotional. They often suffer with what's called emotional dysregulation. So they get upset about quite trivial things and like something that may not affect a neurotypical, if you like. So something that others can just brush off, but they may be acutely sensitive, you know, to a comment. You know, they may internalize it, and that can really affect their self-esteem. And certainly we know that symptoms of ADHD in teenage girls can be accelerated during puberty, for example, also with fluctuations in estrogen.
Yeah, I wanted to just, someone's just said the most awful thing. I was stood in a chair at 7 years old in a class with a lazy sign around my neck.
Dreadful.
I mean,
yeah.
Good God, nobody. I mean, that is just it's child abuse.
Yeah. I mean, do you remember being told to face the wall? That was how we. It was like, you know, go
really
and face.
Naughty.
Oh
I was definitely more like a boy at school.
Yeah.
You know,
yeah. So ADHD, actually, you've made a good point. Oftentimes, girls with not the ADD, but the ADHD, they can tend to be more tomboyish. You know, they can tend to be, you know, the female that loves hanging out with the boys, playing football, climbing trees, you know. So ADHD does present in girls. It's not just ADD, because oftentimes people think, oh, girls just have the attention deficit component. They don't have the hyperactivity or impulsivity, but that's just not the case at all. But going back to kind of, you know, the hormonal fluctuations
because
that occur.
Somebody's got a young girl who she thinks has ADHD, but how do you differentiate? She seems to be having some of the symptoms like the daydreaming, the lack of concentration. But is it not just her hormones changing? She is 15.
Yeah, well, obviously, you know, that is a very difficult time. The teenage years are horrendous, let's face it, for most people. Yeah, they're awful. But yeah, during that time, girls may seem, you know, more dramatic and emotional, as I said, about little things which can cause mood and behavior disturbances, or they can become quite isolated as well, sort of preferring to keep themselves in their room, for example, as well. So on top of problematic mood swings, they may develop anxiety and literally go into themselves. So oftentimes, females of ADHD can have what's called a poor locus of control. So what that means is they attribute success and failures either internally or externally. So an external locus of control is, for example, let's talk about it on a positive note first. Say they study for their exams and they get a pretty decent grade. You know, they're like, oh, that was just down to fate or chance or luck on the day. Or say they didn't really study very hard for their exams and they got a pretty poor grade. Then they'll be like, oh, the teacher's biased. They just don't like me. You know, that type of thing. So I think this is another important point in terms of differences between boys and girls. Girls tend to internalize things, and that can also, you know, cause a lot of problems in terms of their self-esteem and self-worth and how they feel about themselves, because there's this level of emotional immaturity also in teenage girls. So we've had discussions before, Davinia, I'm sure you'll remember, on the maturational delay hypothesis and this developmental lag in the brains of children with ADHD. And we know this is because the frontal cortex is the last part of the brain to fully develop. It doesn't really develop until kind of early adulthood, so around 23, 24, 25. And the frontal cortex is, of course, a part of the brain that reins in all those kind of irrational, kind of risk-taking, novel-seeking behaviors. It's a part of the brain which is described as the brake. So it makes you pause and think and say, hey, is this a good choice? So we know that girls in particular have levels of what's called emotional immaturity. And if anyone wants to know more about that, they can look up the work of Professor Philip Shaw and Dr. Katia Rubia, who have published in this domain and using sort of neuroimaging research as well. But certainly hormonal fluctuations that occur during a female's menstrual cycle can worsen symptoms. And girls,
would you consider some sort of hormonal, I suppose just being able to track the hormones might help you decide whether it is a hormonal treatment you need or if it is indeed, I mean, a condition that needs diagnosing and you work from there. Would you, in your practice, if you were presented with a girl aged between 12 to say 15 who has all these symptoms, would you have a look at her hormones and her bloods as well?
You mean if she was clinically diagnosed with ADHD?
Yeah, or if it was something that, because there's so much guesswork as parents, you don't know if they're just, if they're doing it on purpose, if they're, you know, I mean, I've got one kid who really acts out, you know, but I know I can see his mind ticking over. He's doing it because it gets a reaction from me. So if he acts, emotionally disturbed, he sees I get a reaction, and then he gets whatever he wants. Then, you know, I'm being manipulated.
That's right, totally. ADHD kids are absolutely amazing at doing this. Like, they have this ability, and I'm not sure if they even recognize they're doing it themselves, but like winding people up and getting a kick out of people, because it actually gives a boost to the activity of their brain. So it's almost a way of kind of normalizing their brain function, which is really interesting. But I mean, in terms of like what I would do, so first and foremost, it's really important to identify and diagnose, number one.
Okay, so let's do this in sort of chronological order. So let's have a hypothetical. A mother comes in with a daughter who's showing signs of a dysfunction, some sort of neurodiversity. She doesn't know how to explain it. The young woman's heading into puberty. She finds it very hard to concentrate. She finds herself isolated from her friends. She's got no real peer group. What would you do in this instance? Her work's suffering. She doesn't want to go to school, etc., etc. And she is disruptive, and she seems emotionally immature in the household. Where would you start?
So I think you've got to start right at the beginning, which is to pre-screen for symptoms. There's a number of ways you can do this. I don't diagnose myself, but I work with child and adolescent psychiatrists who I will refer clients to. So I will pre-screen. And you can do this using the Conners parent and teacher rating scales, which assess for the clinical threshold. So, you know, it's a series of statements, and the parent has to rate each statement in accordance to their own child's behaviour within the last month. And
sorry, what was that assessment paper called again?
So it's called the Conners teacher and parent rating scales. There are short and long versions of the form. What I also like to use is something called the Strengths and Difficulties questionnaire, because that also looks at different features of diagnoses, from kind of hyperactivity and concentration difficulties to prosocial difficulties. So in other words, how they interact with other children within their peer group. Also looks at ADHD, emotional issues as well. So you can pre-screen using standardized clinical questionnaires. If you think that young person may have symptoms of depression, anxiety and stress, and you would use something called the DAS, which can assess for the likelihood of those conditions also being present, because oftentimes, especially in females, they won't just present with ADHD symptoms, but they may also have depression and anxiety. And also what's really important, which was published recently by a developmental psychologist, I think at the University of Budapest. So he pre-screened children for ADHD. And what he found during that pre-screening was that over 70% of females with ADHD presented with something called non-suicidal self-injury, which is also known as self-harm. So I think that's really important to recognize what the overlapping features or the increased risks may be with a child who is struggling with attention and concentration.
Because that just brings me, because I like to sort of like bring in the audience as well. There's a lady here who's got an 8-year-old, and she's so frustrated. She started to claw her arms and face until she bleeds. What does she do to help?
Yeah, I mean,
it sounds like the little girl. It sounds like she's screaming underwater. She can't articulate what's going on.
So I'd like to know, whether that little girl has an existing diagnosed neurodevelopmental condition, whether that's ASD, you know, autistic spectrum disorder, or ADHD, or whether she's literally just presenting with self-harm, but certainly an immediate referral to the doctor. So you can visit your GP. And I'm really sorry, you know, to this lady, whoever it is that's experiencing this. It's, incredibly worrying. But the first thing I would recommend is go to your GP, explain what's going on. I don't know whether there's some sort of situational...
No, she's not got any existing anything at the moment. Okay. So obviously it's something showing up, isn't it? That the child can't articulate what's going on internally.
That's right. Absolutely. I mean, there may be something going on at school that mum is not aware of, but certainly I would go to the GP first, and then also, you know, go and visit her school teacher, find out if there's anything going on at school. That's really critical. And then ask your GP for referral to child and adolescent mental health services, so that, you know, investigations can begin by qualified professionals such as a clinical psychologist. I think what's quite worrying at the moment is, you know, mental health is at an all-time high, certainly during, you know, lockdown and with, you know, the pandemic we're living in. And I know that parents, even prior to lockdown, could be waiting up to a year for an assessment and diagnosis of autism. So, I mean, if you have the means, the only alternative route is to seek out a private clinical psychologist. I'm happy to help parents who want to go down that route with referrals, or a child and adolescent psychiatrist, to avoid that, you know, that long wait. It's really sad that we're in this situation, and that's why I also set up nutritiousminds.org in 2017, which is like a kind of a non-profit side to bridge that gap. So we have successfully paid for at least 3 diagnoses for children whose parents suspect there's something going on but don't have the funds to pay for it privately. But unfortunately, right now, I haven't really been able to successfully fundraise to have grants immediately available. But that's something that I want to work on in the future, so that I can help bridge that gap, because it's really critical when parents are just tearing their hair out. They don't know who to turn to. You know, and even just getting a GP visit now is problematic. It really is.
So coming back to your sort of order of attack. So you do the online sort of screenings, basically.
Yes.
You do the DAS and you do the Connors, and then say if you can see it, that there is something there. Where's their next port of call after they've done the online sort of assessment?
Yeah, so in addition to the kind of standardized questionnaires, I also like to use the CHIPS, which is a kind of interview to assess for symptoms of ADHD as well. I like to do a verbal and non-verbal reasoning assessment, which can look at their strengths and weaknesses in terms of cognitive function, so that they have a really kind of thorough pre-screening of what's going on. And then as we're going through this process, if I recognize other symptoms, then of course I can, you know, look at other, you know, symptoms in more detail, like anxiety, if they're presenting with generalized anxiety disorder or attachment issues or whatever it is. And then, of course, like I said, I work with a network of educational psychologists, clinical psychologists, and child and adolescent psychiatrists. So then I make that referral and they get their diagnosis. And oftentimes after that, that can lead to potentially, depending on the diagnostic labels, that can also help a parent apply for what's called an education healthcare plan, which is a sum of money that is given to the school so that they can have one-on-one, you know, teaching assistance or extra occupational therapy support or social skills training or anger management or whatever it may be. But in terms of adult women, it's a kind of a bit of a different picture as well. I mean,
yes. Okay. So with the school, when you've got the sort of safeguard of the school, you've got your diagnosis and you've got experts around you, that's one thing. Fortunately, our children are now in a time where parents are more aware of these diversities, and we can fix our life around them as opposed to the other way around. Now then, what if you've left school, you've got kids of your own, or you're trying to set up a business, or you're just trying to get through life, you're trying to get to work on time, but you just cannot juggle life? Can you talk about the middle-aged woman with ADHD who has got herself through life thus far, but with, of course, a numerous fallouts, wine, smoking, getting pregnant? I mean, all the things that come with impulsive behaviors and addiction. Could it be a root cause? Could the root cause be an ADHD misdiagnosis, or, you know, and
absolutely, it could be.
How do we bring it all back in so we can work our life to our best of our ability now?
Yeah, so often women with undiagnosed ADHD or ADD can experience kind of overwhelming feelings of psychological distress on many levels. So feelings of inadequacy, as I mentioned already, the imposter syndrome, feeling that they don't quite fit in, feeling that something is different in them and has been for quite some time, which can, of course, bring about low self-esteem or this constant over-analytical thought process, mind wandering again. They can also overcompensate or develop compensatory mechanisms like, you know, making sure that they write everything out, things to do lists, that kind of thing. They can't work without their planner, you know, so they find these kind of superlative compensatory mechanisms which help them with their organization. But oftentimes, females with ADHD can always be people pleasing, you know, especially in the workplace as well, because they're fearful or anxious that, you know, people are going to sort of realize that they struggle with organization or multitasking, as you mentioned earlier, and daily tasks may seem impossible. For example, the thought of completing a long form or preparing for a presentation or, you know, filling out a tax return may fill them with utter dread, which then leads to chronic procrastination, you know, like having every intention to do that task, but putting it off, doing everything else but that thing that they have to do. And I think also as well, because women are seen as caretakers, so we're meant to be taking care of everyone else, and that role can be incredibly difficult for especially mothers who they themselves have ADHD, although, you know, that they might not be aware that they actually have it. And this can create feelings of inadequacy. Often, you know, females with ADHD are overachievers, you know, and also this is the same in dyslexics. We've seen this over and over again because they've developed all these amazing compensatory mechanisms to make them super organized. So, you know, to everyone else, they may appear, you know, super confident, completely organized, but that's because they've had a lifetime of learning how to calm the chaos, if you like, how to create structure in their lives. So, yeah, I mean, in terms of the downsides, yes, there is this side of self-medicating that you referred to. And, you know, common addictions are the development of substance use disorders, anxiety disorders, especially social anxiety.
That's when alcohol comes in, I guess, doesn't it?
Absolutely, absolutely. And also kind of obsessive compulsive type behaviors, where they can become very rigid and have to have their routine. It can affect them in terms of sleep, disturbances in sleep, where they just cannot switch their mind off. There's all these intrusive thoughts and, you know, one thing flipping from one thing to the next, you know, and it's like trying to still their mind is incredibly problematic. And that's why stuff like mindfulness meditation can really help. But not only that, other risks include eating disorders, self-harm. We've spoken about mood disorders. You know, they have an increased risk of developing depression. Yeah, this can create huge difficulty, especially if they are, you know, busy in terms of their employment. Their career might be, you know, very demanding.
How would we know if it's not just 21st century life and having basically putting too much on our plate at once, being the wife, being the mother, being the businesswoman, being pretty, being fit, having a great night's sleep, you know?
Yeah.
I mean, how do we know that we're not just putting too much in our way and we actually don't have ADHD? We just have literally got a stupid lifestyle that needs managing.
Yeah, of course. I mean, you're kind of describing burnout, which can happen to absolutely everyone. But I think it's different because, as I said, like a female with ADHD or ADD has lived with these symptoms from a young age. So it's not something that just suddenly materializes.
So you don't just develop it. So say something like the perimenopause, that wouldn't just flare up an ADHD attack, would it?
Well, I mean, it can do. Certain environmental situations can heighten ADD-related symptoms, which is different from having a diagnosis. So as I said, we can all have periods of, you know, low mood or inattentiveness or disorganization, but it has to be persistent for a period of time. And also it's actually the impact that it has on your everyday functioning, and that's occupationally, you know, that's academically, that's in relationships, that's in a whole range of areas of your life for it to warrant a formal diagnosis. So it's not just like, oh, I've struggled with concentration for a few months, but, you know, then that might be because your mood is low. So depression and ADHD can often overlap, and hence why when females present themselves to their GP, they are often diagnosed with major depressive disorder or anxiety or both, and the whole ADD component is completely overlooked, or they're labeled with borderline personality disorder or bipolar, or they're told that they're suffering with substance use disorders, and once they, you know, have a period of sobriety from that substance, then the other symptoms will calm down. But that's not the case with ADHD. I mean, the issue of self-medicating is rife among anyone with ADHD, because what they're trying to do is normalize their own brain function. And I always say, you know, humans are wired to seek pleasure, avoid pain, and substances like alcohol, you know, nicotine, marijuana, cocaine, what they do is they release dopamine, and you know all about this, you know, it's the hormone that's attached to reward and pleasure. So they're feeling rewarded, they're feeling pleasured, and then that keeps them going back for more. And then it becomes a cycle of addiction where it's the kind of binge, withdraw, repeat. And this is this endless cycle and loop of addiction.
I often, remember when I used to drink, that first glass of wine used to bring all my thinking into line, and I would be able to tackle, would you believe, paperwork.
Yes.
You know?
Oh my God.
Do it with gusto and joy.
Yeah.
But by the time I'd finished it, I was on my third glass of wine and I was already too drunk to finish it.
Yeah.
But for that moment, that first couple of glasses of wine, I would have clarity, motivation and drive and cognitive thinking and recognition of, you know, I'm doing something esteemable. I have to sort of like mention, it is only on Monday did I send off my passport to put it back into my maiden name of Taylor. It's been Gardner, and I had a really acrimonious divorce from my ex-husband Dave Gardner. I think 12 years ago.
Gosh.
So it's taken me, I lost my passport, and then I had to replace it with the Gardner again. So it's come up to 10 years now. I've been meaning to do that paperwork. A decade I've been putting off paperwork because it puts a fear of God into me. And I had to get someone to help me to do it. And then the passport office rang up and said, you've sent the wrong stuff in. I came out in a rush because of the thought I've got to do more paperwork. I would rather run a marathon backwards than do paperwork.
Well, there you go. Hit the nail on the head.
I'd have done it like that.
Yeah. And that's why there's this phenomena, especially in America, where people without ADHD are taking psychostimulant medication illegally, you know, buying it from their diagnosed ADHD peers to get them through exams. I mean, it's even been known that professors writing grant applications will, you know, drop a Ritalin, because they have to stay up all night.
I've been in loads of rehabs, and my primary was always alcohol and not beer. Strangely enough, it was always wine or vodka.
Beer's disgusting.
Beer used to make me really depressed. So there's something that works in my brain function with particularly white wine, but whatever. That was 12 years ago. But there was a lot of people in there who are addicted to Ritalin.
Yeah.
So could you explain the dangers of the normal substances that are given to children, sometimes kind of without much of a diagnosis, and what they do to the brain? And if you think there is another way to treat ADHD without these supersonic drugs?
Yeah, so the first line of treatment, certainly here in the UK and in the States, is pharmacological. That's where we're at, unfortunately, even though it goes against the NICE guidelines, which is the National Institute for Clinical Excellence. And you can find those guidelines online, and they detail exactly what should happen following a diagnosis of ADHD. So medications are often methylphenidate. You may have heard of brand names you mentioned, Ritalin, also Concerta, or Vyvanse or Adderall. These are very popular. Also antidepressant medications.
Yeah,
are
can you
also
tell
given.
me how an antidepressant would help someone? Just 1 second, Juice's walking. What's
Yeah.
on, darling?
I can't find my iPad.
You can't find it, your iPad for online learning. Can you go and ask Daddy, please? Oh, can you give me 5 minutes and I'll come and find it? Good boy.
Yeah, he's so cute. Oh my gosh, his little voice.
So hey, I can't find my iPad.
I know,
so,
so sweet.
Sorry, yeah.
Let's talk about antidepressants.
Antidepressants. So, can you explain how a doctor would think an antidepressant would work for someone with ADHD?
Well, oftentimes it's because they haven't responded effectively to a stimulant, because only around 2/3 of all children diagnosed with psychostimulants actually are called clinical responders. So that leaves 1/3 of them that don't respond in expected ways. And oftentimes it's very experimental. The child or adult is kind of weaned onto the dose. Doses can be increased or decreased according to how they respond. And as I said, it's not always successful. It's not. And also there's this other issue with medication, is that after a period of time, the child can be desensitized to it, warranting a higher dose.
Addiction, basically.
Yes, yes. And then also there's this rebound effect, which when the medication wears off, the child's ADHD symptoms go absolutely crazy. And that's always really difficult for parents to cope with, because during the day, they are better able to focus and pay attention. I mean, a lot of the neuroimaging studies show as well that it can normalize kind of brain function, but the long-term efficacy is not conclusive. So there is no concrete evidence for long-term efficacy. In the short term, yes, we know it can be beneficial and helpful. And, we spoke about antidepressants, selective serotonin reuptake inhibitors, SSRIs. So things like Wellbutrin, which is an antidepressant, which is commonly prescribed as well, because that person hasn't responded to the stimulant medication. So then you go down another experimental route to see if a non-stimulant can actually decrease symptoms. So that's where we're at. There are, of course, non-drug-based treatment approaches as well.
Yeah, I wanted to touch on that. A lot of people, of course, they don't necessarily want to go down the medication route because of the burden on the liver and obviously the rebound effect, because you don't want to make yourself feel even worse than you
did.
And
the side effects and the other
side effects. And the fact that you'll probably have to go through 18 months worth of trials and error before you find
guinea
something.
Pig. Yeah.
Can you please explain what we can do immediately just by eating?
Yeah, of course. So, my approach is, of course, a nutritional one. And, research has shown clinical efficacy in terms of reducing symptoms of ADD, ADHD, depression via the diet, and really just eliminating sort of white refined sugar, junk and processed foods, making sure that you're eating healthy foods, especially oily fish, because oily fish contains omega-3s, but not only omega-3s, all the trace elements you need to absorb those omega-3s, such as iron, iodine, magnesium, zinc, selenium, and so on. So you're kind of getting your omegas plus the multivitamin in a piece of fish. And I appreciate that a lot of children, for example, don't like eating fish and seafood. Therefore, they should test their omega-3 index and take supplements, because omega-3 is critical for brain development, absolutely critical. And
you like Bare Biology, don't you, for that one?
Yeah, so I mean, there are some really good supplements out there. There's Wiley's Finest organic oils, there's Bare Biology, there's the Barleans organic oils that can be bought online. But it's not just about the omega-3s, it's also about the other vitamins, making sure that you have adequate B vitamins. For example, I like this spray here, which you can just spray into your cheek or under your tongue. You could also do it with vitamin D as well.
What brand's that?
What brand? I'll hold it up for you. Can you read it?
What is it? Better what? Better.
I actually don't know. I should know the brand. Better You. Yeah. Better You.
I'll just do an app.
Sure.
So that they can link.
Yeah, and children with ADHD are also trying to normalize their brain function, and they're also self-medicating, and oftentimes that is exactly with sugar-laden foods and that release dopamine that also can begin that cycle of addiction and increase this problematic behaviors later in life, and potentially to other substances too. But ways in which you can help as an adult, I would strongly recommend that you find a life coach, someone who has experience of ADHD, who can help you in both a personal and professional sense. So in terms of, excuse me, in terms of like goal setting, goal mapping is very popular, creating vision boards so that you can see all your aspirational kind of goals in front of you. That's really important. Journaling, making sure you do gratitude lists every day, practicing mindfulness meditation, we know has resulted in changes in the brain via a process called neuroplasticity. And also just accepting your ADHD challenges and seeing them in a positive light. Oftentimes people describe ADHD as both a gift and a curse, but it really can work successfully for you. We have so many role models, like will.i.am, who I absolutely love, who has ADHD. I mean, that guy's a genius. And there's so many people in the public eye, actors, entertainers, writers, inventors, we have Olympian gold medalists. We have all these people demonstrating how ADHD can work with you and your child. I think, plenty of compassion and empathy and patience and understanding is required by parents who are presented with kind of neurodiverse children. I always maintain that, special children are given to special parents, and I really do believe that. But yeah, there are so many ways you can help declutter, get organized.
Okay, so can you tell us, imagine we've got a pretty clean diet, taking out the sugar. I'm speaking specifically for women who feel like they've turned to alcohol to try and manage their lives, to try and get some, particularly now because of all the things that are going on, the online learning is just to behold, to be perfectly honest. And just even remembering to plug the bloody iPad in at night is proving challenging for me. I'll just have my phone, whatever.
Post-it notes, Davinia.
Post-it notes, okay.
Post-it notes everywhere.
What can I take? What can I buy to make me feel better? What is there that's out there that I need to help me know that I'm taking a step in the right direction? So, what would you say the ideal breakfast, the ideal lunch, and the ideal dinner would be, and what supplements and when should I take them? I'm 43 years old. I've got 4 kids, 2 exes, and 2 mad dogs, and I'm really
oh my gosh, where do I start? No, I'm joking. So basically I think definitely breakfast is super important to set yourself up for the day, and my go-to is also blended juices, 60 to 40% vegetable to fruit ratio. And when you choose your fruits, try and choose berries, like blueberries, which are full of antioxidants, polyphenols, to boost your brain. I always post recipes on nutritious_minds for anyone that's interested. But breakfast, ditch the breakfast cereals, the pastries, the croissants, the bacon buddies, and literally be kind to yourself, practice that element of self-love and self-care by feeding yourself like a healthy and delicious, nutrient-rich breakfast, for example, scrambled egg, smoked salmon, avocado,
I had that for dinner last night again.
Oh, so nice. I know, I could live on it. And then, don't skip meals. You're not doing yourself any good unless you're following some sort of fasting regime, which is medically supervised.
I find that intermittent fasting for me actually helps, because if I start eating something happens with my digestive system and it seems to take all the blood from my brain, even if it's just protein, and I just want to go to sleep. And I can't at the moment. If I didn't have all the kids and I was on holiday, fine. But I need my wits about me because there's like a million different emails coming through from a million different schools and a million different dads. But hey, that's my fault.
So most people with ADHD start their day with coffee. They need that hit.
Coffee, which of course I do.
Coffee is a stimulant drug. Let's remember, you know, I love coffee, so I'm not going to knock it. And it has been linked to, you know, various aspects of cognitive enhancement, including memory and also focus. But it also is very dehydrating, and it can also what was the point I was making? I've actually forgotten now.
Just breakfast, really. We were talking about foods, and I was saying that I intermittent fast with an organic coffee.
Yeah.
I do believe it does have amazing properties in it, and you know, we've been drinking it for a million years.
It decreases blood flow.
You have to do it. You have to cycle it. Like, you have to cycle everything. You have to come off it and go on it and come off it. Otherwise, you don't get the effects of it, and then that's pointless.
Yeah, my point was it decreases blood flow to the brain. So it can be a double whammy, you know, in terms of the focus and concentration, because our brains, of course, need to be oxygenated. So, I mean, in terms of drinks, if you're going to have an espresso or coffee in the morning, have it with breakfast if you can, and certainly for teenagers, because you know they're having to be homeschooled right now, but before that, prior to that, they were in a classroom. And what happens is, if they're not having breakfast, their blood sugar levels are so low, and that is so impairing in terms of focus and concentration. And if they have a sugary snack, what that does is it, you know, spikes up their blood sugar levels, and then of course what goes up must come down, so they come crashing down, and that leads to mood disturbances and irritability. So set yourself up for the day by having a really you know, omega-3 and protein rich breakfast if you can, and don't skip meals unless, of course, like I said, you're following some sort of program. And exercise is really key, because it releases the body's natural antidepressants, our endorphins, which of course make us feel great. You know, so exercise and nutrition work synergistically to optimize brain function. So try to have at least 30 minutes every day of exercise.
I often say that when I run, I'm not running to lose weight or to be able to treat myself to some cake. I'm running because it is much more powerful than any antidepressant I've ever taken, and I've taken all sorts of pills and thrills and
absolutely.
I just want to go back to, just while we've got the last 10 minutes, what books do you recommend on ADHD, specifically for teens? And she's also got dyslexia. Her daughter's 15, and I think she's just stumbling upon this sort of these, I mean, it is kind of like a breakthrough for some people. Oh my god, that's what's happening to her. So I recommend that parents of any neurodiverse child go over to Jessica Kingsley Publishers. They are really, in my mind, the leaders in the field in terms of publishing books that are easy to access and follow for parents who are raising kids with ADHD and autism. I'm not biased because they're also publishing my book, because I actually used to read all their books prior to them accepting my book for publication. So when's your book out, by the way? Is it out yet?
So it's available to pre-order on Amazon. It's called Smart Foods for ADHD and Brain Health. It goes over the kind of neuroanatomy of the brain, the differences, all the behavior in terms of the different neurodiversity. It talks a lot about nutrition. There's a bunch of recipes. And importantly, there's also parents talking about their own experiences, and individuals who have, you know, developed amazing coping strategies and have gone on to lead very successful lives, having kind of lived with ADHD. So it's really inspiring as well. And grab a copy.
Definitely. I can't wait for it to be on general release. I've got it, but I've not.
There's a question there. There's 7 different types of ADHD by Dr. Amen. Yes, I have, and I have a copy of it in my home. And I think it's really interesting. Of course, it differs from the DSM-5. It's not yet incorporated into any type of clinical practice or acknowledged as kind of credible by the scientific community, but I found it fascinating. And it's a really interesting read, Emma.
Could you also... I don't know if you lost me there. It's just got a low battery. Hi, Jude. Who can she see privately to do with sleep as well? Does that often run in tandem, sleep and ADHD problems?
Absolutely. Hello.
He's hiding. They're running around the house.
Okay.
Like I thought I'd be safe in my teenage son's room, but he's found me.
Yeah, he's so lovely. So yeah, sleep disturbances are very common in children, adolescents and adults with ADHD, and oftentimes melatonin can be really helpful.
Well, she'd have to get melatonin from a doctor, right?
Unfortunately, in this country, in America, you can buy it. If
you're on holiday in Spain, it's fine.
Yeah, you can buy it in CVS. I'm not sure why we're so strict here, but yeah, you can certainly get melatonin. But I also recommend magnesium in terms of drinks and also salts in the bath. So I always say, you know, put your child in a warm bath full of magnesium salts. And also I find what else can be really calming is making yourself your own essential oil spray. So you can buy these little kind of sprays, dispensaries, and then you can put a base oil like almond oil or coconut oil, and then you can add whatever oils that you like, whether that's frankincense or whether it's, you know, whatever your neroli, whatever your favorite oils are, you just add a few drops and then spray it gently, you know, onto the skin, and the smell is just very soothing and calming. And there's also things like pillow mist or sleep mist by I think it's Naomi or Numi. Yeah. They're really good as well.
And what type of magnesium would you recommend? It's citrate at night, isn't it? Because one of them is good for brain function, so it's magnesium citrate, isn't it?
Yeah, so I think, again, you, I'm not sure if you can get a spray of magnesium or not.
You can actually.
Yes,
I mean,
I was going to say
magnesium for after a workout. You know, if you've done weights or something, you can spray it topically and your skin, it gets really itchy. If you're, so it said on the bottle, if you itch after it and your skin's a bit inflamed, it's because you are desperate for it. And
wow.
So it's a really good test to see if you are like low.
Well, I'm sure you know the brands better than me.
I'll put a list. I am a professional shopper. But God,
exactly.
I really need to stop making some money.
You should make your own.
Talking to this nice lady, can you give me 1 minute, baby face? Just 1 minute. 1 minute, thank you. And then I'll be down. See what I mean? Spinning plates. Could you just mention what sort of blood tests you'd look out for? This is my final question. What blood tests would you do on a child or on a woman that might indicate, you know, you could be lacking in certain minerals? Not necessarily that you do have ADHD, but you need to look at these. Yeah.
So basically what I do is, I think what's really important is when someone presents with a diagnostic label of ADHD or autism, it's really important to do thorough investigations. I've already mentioned seeking out clinical and educational psychologists. But in terms of my practice, what I do is I send the client off to a laboratory in Weymouth Street, W1, where a phlebotomist will take a blood draw, and then we will do a full nutritional evaluation to assess for what's called nutritional insufficiencies, and especially in key brain selective nutrients, which we know govern and facilitate neurotransmitter function. So I look to see whether that person is presenting in levels below the recommended reference intakes. And I also assess for nutritional intolerances, so food intolerances and food allergies. We can also do stool tests to look at the gut microbiota kind of profile as well. I think it's really important, if you're interested in nutrition, then we do know that improving the diet can improve brain health, and especially in terms of reducing ADHD symptoms and improving mood, enhancing cognition, focus, attention, concentration. Because oftentimes people are coming to me and their diets are just lacking in the basic nutrients, and it's almost a wonder how they're getting through the day. So yeah, I think you've got to really, if you're interested in nutrition, you're interested in changing behavior, then My book explains all about this and provides lots of case study examples as well.
Fabulous. I think, well, for me, I always try and eat for my brain, because
Yes.
my brain is basically, it's everything starts in my brain. It's whether I move to put on a pair of trainers or move towards the fridge or freezer for ice cream. You know, my brain is giving me that permission to do either yes or no. And I think if I certainly feed my brain in a positive way, my actions are normally more positive, you know.
And you're not alone,
because I'm in recovery, you know. I don't want to start triggering certain behaviors or cravings, because craving for something is fundamentally the most horrific thing ever.
Absolutely.
You know, there's nothing worse than not getting what you want.
Absolutely.
Just quickly, Emma's just said, do certain SNPs on genes show anything? I mean,
to be honest,
on this, and they said there's definitely something in the methylation cycle.
Yeah, I mean, we probably don't have time to go into all of this, but certainly copy number variants, which are alterations in the structure of the DNA in terms of additions or depletions, are implicated in ADHD, as well as a wide range of other kind of psychiatric or mental health conditions like schizophrenia and so on. But again, the genetic research is not conclusive, and we know through the field of epigenetics that plays a role in switching on or silencing our genes. So it doesn't it's not conclusive by any means.
Okay, I mean, there's a great book Ben Lynch did, Dirty Genes. That's kind of interesting. I mean,
it's fascinating.
Science, it's not complete science, so you won't get your GP saying but to be honest, I think it's worth a read just to become aware of it. So fabulous, Rachel. Thank you. That was fascinating as ever. And just for those
pleasure.
Just for that, your book's out soon, isn't it? And thank you.
February 18th.
You're doing fantastic work there. And all
Thank you so much. I always love chatting with you, Davinia. Thank you so much. Michelle. I love your work.
Tons off you. Enjoy the rest of your day.
Yeah, lots of love. Take care.
Bye, guys. I'll upload this immediately.
Bye to everyone. Bye.